Let me just add a couple of things on the vaccine side. Mike has really covered.
WHO is very concerned over the evolving situation in China, with increasing reports of severe disease. In order to make a comprehensive risk assessment of the situation on the ground, WHO needs more detailed information on disease severity, hospital admissions, and requirements for ICU support. WHO is supporting China to focus its efforts on vaccinating people at the highest risk across the country, and we continue to offer our support for clinical care and protecting its health system.
Vaccines and things like the mRNA vaccines, and I was wondering if the WHO has had any.
The rates of vaccination in China, while on the face of it are high, they still lag behind in terms of overall coverage, particularly when you look at people over 60, particularly when you look at full vaccination, which I think in the case of the available Chinese vaccines would likely be 3 doses of vaccine as a primary course, not 2 plus a booster. And I think we're talking, protective efficacies of hovering at 50% or less for those 2-dose regimes in someone over 60. That's just not adequate protection in a population as large as the population of China.
Thank you very much, Dr. Tedros. And the next...
China made massive progress over the last number of weeks in actually rolling vaccines out. I think there have been a 600% increase or more in vaccination rates over the last week or 2 weeks. So I think what we're seeing is that China is recommitting itself to that strategy. It's distributed many different vaccines in its arsenal all around the country. It's setting up vaccination sites. It's targeting that vaccination. Although we're not involved, we believe there are discussions going on between the Chinese authorities and some, at least one of the mRNA manufacturers, around registration of their vaccines and also around production within China itself. But we're not privy to those discussions. We would encourage that, obviously, and maybe Rogerio, your group works very much on this. We would certainly encourage that kind of work, both to import vaccines but also to find arrangements where vaccines can be produced in as many places as possible.
On that, thank you, Mike. We had a meeting with the Chinese authorities and the Chinese...
Now, it could be, again, that the reported data is behind the reality. In a fast-moving wave, you might have reported 3 days ago that your hospital is okay. This morning, it may not be okay, because the wave has come, and all of a sudden you have a very high force of infection. So I wouldn't like to say that China are actively not telling us what's going on. I think they're behind the curve in what's actually happening, as everyone is in a situation like this. And we need to get better ways of getting that data quickly so we can monitor together the situation, because it's in the interest of the Chinese health system to know where the pressure is in the system at any one time.
Prepared as far as access to treatments and diagnostics are concerned, and what is the meaning?